The American Cancer Society estimates more than 192,000 cases of prostate cancer will be diagnosed this year. But the good news is, if caught early, the survival rate for prostate cancer is very high. Dr. Samir Keoli from ProCure joins me now, along with Phil Dame, who is a patient there. Thank you both for coming in.
Thanks for having us.
Phil, I'm anxious to talk with you as a patient, but we're going to ask a few questions of the doctor first, if I may. Let's start with prostate cancer and how it's diagnosed, doctor.
Sure. It used to be that prostate cancer was diagnosed with advanced symptoms, but now we're fortunate to have the prostate-specific antigen test. It's a simple blood test administered to men after the age of 50, and most commonly an elevated PSA lab test leads to a diagnosis of prostate cancer.
And of course at ProCure, the new facility that opened in Oklahoma City last summer, you're using Proton therapy. How is that different from maybe some of the more traditional therapies we've heard about?
Sure. So regular x-rays, or some people call it IMRT, is also effective, but protons are more effective. And they're effective in that, think of regular x-rays or IMRT being like a bullet. You'll damage the cancer, but you'll also damage the tissue both on the path and on the distal side of the cancer. Whereas with protons, they're more like a firecracker. You put the radiation in the middle of the prostate cancer, poof, and then it'll damage the prostate cancer, but it won't damage the normal tissue. And to put in perspective, when you get regular radiation versus protons, you'll give about 300 to 400% more radiation to the normal tissue with regular radiation than you would with protons.
A very finite target.
Correct.
Is everyone a candidate?
We think most patients, certainly with prostate cancer, would be a candidate, but actually most of the patients we treat do not have prostate cancer. But our group, Radiation Medicine Associates, has access to the best technology, proton or not, and so we always say schedule an appointment with your doctor to find out.
Phil, you were diagnosed with prostate cancer and are being treated at ProCure. Tell us how you were diagnosed.
Well, I have a high PSA. I've had it for 10 years. And the third biopsy I had, which was last year, it came up cancerous.
And how did you learn about ProCure?
That's interesting because I had already scheduled surgery.
Huh.
And my office manager happened to find ProCure on the internet.
Well, that's interesting. And how is treatment going? Because you are under treatment right now at
Yes.
ProCure.
Well, I met with Dr. Keoli, and that was last year, right about the time they were getting ready to open. In fact, they weren't open when my wife and I took a tour of the place.
Huh.
Ceiling panels were missing. It was disarray, but we got to tour the facility, and he recommended that I take some hormone therapy to shrink the prostate. And the neat thing about that is I now have hair on top of my head that I didn't have before.
That's something.
And then about 3 weeks ago, I started the proton therapy at ProCure.
Well, we wish you the best with your therapy. Thank you for coming in. And the best to you with your effort at ProCure. We appreciate you shedding some light on the therapies there.
Thanks for
Thank you
having us.
both.